Welcome to the American Academy of Grief Counseling's video on psychodynamic therapy and its role in grief itself. So, with psychodynamic therapy, we are looking at the subconscious. We are literally entering into the inner depths of the brain itself. And it finds its basis with Sigmund Freud, and it looks to find underlying issues of the person at the subconscious level to explain the current problem. So trauma, mental issues, or other behavioral issues all stem from the subconscious mind and an earlier trauma, according to psychodynamic theory. Hence, unresolved issues lead to the current problem that one is experiencing at the behavioral level. In utilizing this type of therapy, the counselor will look to see what is the cause of the current behavior or the particular block within the individual subconscious to help the person understand why their behavior is the way it is and to find ways to understand the past and to resolve this issue and face it. One is also better equipped to identify then and understand and respond properly to the current emotion. If you're familiar with Erik Erikson and his 8 stages of human development, this is in essence a psychodynamic model because it identifies certain stages within human development. And if those particular stages are not met with success, then later stages are affected negatively in their growth because of the inability to get past an earlier stage. So various goals have to be met as one develops throughout life. And this is really the core of what psychodynamic therapy looks to look at and fix. Now, psychodynamic and cognitive behavioral therapy can be both utilized in grief. We have discussed cognitive behavioral therapy in previous videos. But there are differences, but they have very similar goals. So CBT looks at ways to manage how we react to things in ways of reframing, in ways of reshaping thoughts, and then to rewire oneself. But psychodynamic therapy instead goes to the past itself and looks to see why the current behavior is the way it is, to understand how that behavior is forcing one to react. So if there was early trauma or a type of grief that exists within an individual, psychodynamic would take the person back. Maybe it's a death of a family member. Psychodynamic will look at that and then look at ways to better analyze that. CBT will look at ways to reframe the particular loss within the current field. So whether we are looking to reframe the false image or the low self-esteem that's associated with the depression or the grief, or if we are looking at the root of the trauma of the low self-esteem and how to proceed forward with it. Both systems, both therapies are very productive. And many times, therapists, grief counselors will utilize a combination or adjust and adapt the particular system to the individual. Because remember, counseling is an art. And as an art, it is more than just making every peg fit a certain shape. Sometimes certain combinations need to be utilized of different therapies to meet the particular needs of the particular individual, because all individuals are unique and grief itself is very unique. So don't become too caught up in, I only use psychodynamic therapy, or I only believe in cognitive behavioral therapy. That both of them have merit within themselves and both have truth within themselves. And sometimes if we just use one over the other, we can go down a road where it's not very beneficial for the patient or the client. Now, psychodynamic therapy is basically a talk narrative-based therapy. So it's going to involve a lot of description, a lot of talking about emotion itself. It's going to be a lot of questions to the individual and allowing that individual to discuss how they feel, to talk about their feelings. So in that way, it is the classical Freudian type of therapy. It's ultimately a very effective way, though, for clients to express emotion and learn how to identify certain behavioral issues that stem from the past and how that trauma from the past has negatively affected their present day. So Freud taught that these tugs from our internal impulses in the external systems we're in will help the individual find balance. And that's what psychodynamic therapy looks to do. It looks to help the client find balance by understanding the past and then being able to push forward with better coping and behaviors for the future. In some cases, though, same thing with CBT, but in some cases, supplemental therapies are needed or various medications. But ultimately, PD by itself is a talk therapy with many proven results, especially for individuals who might not want to go on a particular medication. Remember, medication is usually something that is treated more for true depression when there is a chemical imbalance. Unfortunately, sometimes individuals still need various medications to help them with whatever imbalance or temporarily help them through. But ultimately, it is through these types of therapies, such as psychodynamic, that are going to help individuals redirect and find meaning in life itself. Below is our grief counseling certification from AIHCP. There's the link. Our phone number is 330-652-7776, and our email is info@aihcp.org. Please subscribe to our YouTube channel to watch various other behavioral health or healthcare videos that are similar to this. And also remember to have a good day, and thank you for listening.